name is Elvira Madueme. I'm the Assistant Director of Operations at the Wesley Lawn campus. Very minimal. The first shot was painless, mild soreness at the injection site. The second shot, which was 3 weeks later, elicited more of an immune response, which is normal, so I did have a mild headache the day after. I know that while the vaccine was accelerated in terms of production, that none of the safety steps were eliminated. What they actually tried to do was conduct a lot of the studies simultaneously in order to accelerate the production. So I have great confidence in the scientific community that no steps were missed and that the vaccine we have is a safe and efficacious and really one of our best tools to eradicate this disease. We cannot blame our Black communities for the concerns and hesitancy that they have around this vaccine. There have been some real racial injustices that have occurred that we have to acknowledge. It's not been that very long ago when the Tuskegee experiments occurred within the past 50 years. Those were very bad things that were done to Black Americans. And we have to acknowledge our history. And in order to move forward, we have to be able to recognize what went wrong and make sure that that doesn't occur again. So one of the things that we need to do concurrently is make sure that we have equal representation in all of our disciplines, including our healthcare industry. So having Black doctors, pharmacists like myself, scientists who can be right there at the table, making sure that bad things aren't happening, making sure that the concerns that we represent are brought to the table and are addressed. Those are important things, and I think those are things that we have done in order to make sure something like the Tuskegee experiment never happens again. In addition, making sure that we are represented in those studies. So historically, a lot of scientific studies have not represented minority populations. So you can't always extrapolate that just because something is efficacious, works well in the white community, that it works well in minority communities as well. So it's important to make sure that studies enroll minority communities so that we can say that yes, it also works for us. In the COVID-19 vaccine studies, I know personally several co-workers who were part of those initial studies. And so that gives me great confidence that the results of the studies are representative within the Black community. And I work in a hospital that treats COVID-19 patients. I see those patients firsthand, and I understand the devastation that the disease can have on patients. And so it's not something that a lot of the rest of the community have the ability to see. I mean, it's an invisible disease, and so if you don't know anyone firsthand, it's hard to comprehend the magnitude of it. And so because I'm able to see these patients who are very, very sick, many of them passing away, I feel that I owe it to my family, my immediate contacts, my community, to make sure that I share that side of it, that they understand the gravity of it. And just because you are young and healthy and you may be able to absolutely fight that infection, even if you were to get the infection, you may not get as sick. It doesn't mean that you can't spread that virus to someone else who may not be able to mount an adequate immune response. So your elderly parents, your grandparents, if they were to get that disease, they would likely have a worse outcome than a young individual. Your cousin who has lupus, or your mother who has suffering from cancer, they will likely have worse outcomes. And so those are the individuals that we want to protect. So I continue to wear my mask at work. I wear my mask, I wear my face shield, I wash my hands, I sanitize my areas frequently, I maintain 6-foot distance when I'm around other people, and I do that at work and outside of work. And I encourage everyone to follow those measures even after you get the vaccination, because there's still the risk that you may still pass that vaccine. And until the vast majority of the population is fully vaccinated, that risk remains a reality, and we need to continue to be vigilant and make sure we're doing everything we can to avoid or minimize the spread. So we're going to continue to keep practicing those 3 W's until we can fully eradicate this disease. I want to caution everyone to be very careful about where you are getting your information from. In this era where it's so easy to send information to hundreds of people by a click of a button, and those individuals send it off to another hundreds of people, misinformation, disinformation, half-truths are so easily spread. And even if you see it in multiple venues, they could be wrong. So please be very cautious about the source that you're getting your information from. And I would advise you to go directly to someone that you trust that is within the healthcare community. So your physician, your local pharmacist, a trusted healthcare provider within the community. Ask your questions directly to those individuals. And please just be very, very careful about where you're getting your information, especially if it's coming from the internet.